Well, Vancouver Pride has begun, and the 2021 season has a mix of online and in-person events. We'll list some of those a little later in the program. First, we are letting you know about a new province-wide resource for gay, bi, and queer men, as well as two-spirit and gender-diverse people in BC. It's an online guide called More Than Sex. Simon Rayek is with the Health Initiative for Men, or HIM. Hello and welcome.
Hi, nice to be here.
Nice to have you with us. What does this guide look like and what kind of information will we find in there?
That's a great question. The guide is online currently, and it spans anything from sexual health and pleasure to the norms and societal forces that we experience as queer people that maybe we're not taught about at young ages. It's really meant to be a primer for anybody who might be gay, bi, queer men, or trans or gender diverse, or not even really know what they are, to sort of read up about the things and the forces that affect our lives and get a better understanding of why we experience the things we do.
What's the need for this?
The need is that for over 10 years, HIM and organizations like HIM have been doing lots of sexual health resources and promotion aimed at mainly cis, gay, or bi men. And we've experienced over the last few years a call to action from community members, community leaders who themselves are trans, two-spirit, non-binary, to really broaden that umbrella and to really think beyond just cis bodies and gay men and bi men, and really think about our communities as being as broad as they really are, because we know that our communities are bigger than one might think, and that there are people within our communities that we may not even know are themselves gender diverse. So we've experienced a call to action from those leaders, and recognizing that we're in a position now where we can reach more people and not have to sacrifice the kinds of promotion, sexual health promotion that we've done in the past, but really just make it more accessible to everyone. That's really sort of what this program, this guide, and this project is meant to do.
What are some of the stories you are hearing from gay, bi, and queer, and two-spirited, and gender diverse people in other parts of BC about the gaps in healthcare right now?
We know that there's numerous health inequities experienced by GBTQ2 and gender diverse people, and often those are attributed to a lack of affirming care. Healthcare providers who maybe aren't equipped to meet the needs of our community members, maybe not because of any bias or any sort of internal discrimination, but really just because we live in we exist in a healthcare system that is mostly aimed at bodies and needs that aren't representative of our communities. So when you have trans people afraid of going to the ER because they're afraid of being discriminated against, we see that statistic, and we see that it's something that is being reported pretty frequently, even within BC, and we recognize that there's a need to do something about it.
In addition to this resource, your organization, HIM, does pop-up clinics all over the province. What happens at those clinics?
That's right. We have 5 brick and mortar clinics here in the Lower Mainland, where we offer the whole suite of services related to sexual health, including testing, treatment, as well as sort of post-treatment counseling if needed. But we also, we take a holistic approach to health, and we offer counseling services and social services, recognizing that the needs and the health needs of our communities are beyond HIV, they're beyond STIs. They really go upstream to things like social isolation, anxiety, mood disorders, and sort of growing up in a society that still maybe doesn't completely understand or accept us, or with families or peers who don't completely understand us, and really trying to work through that with our community.
I want to talk a little bit about services that you offer outside of the city. What types of resources are available for people who really need it, no matter where they live in British Columbia?
And this is a big gap that we recognize at HIM, and I think that we are trying to really start to build relationships with stakeholders across the province to address. And the way that we've done that is really that in some funny ways, the pandemic, as awful as it has been, has offered certain opportunities to take some of the services that we do offer in the Lower Mainland, put them online, and make them accessible to people in rural areas. That includes our counseling services, which now we do over Zoom or Skype or whatever services our clients want. And we're able now to both recruit counselors in areas across BC, but also connect clients from across BC to counselors anywhere. And so we have people in rural north talking to someone who has some experience working with GBTQ2 in Vancouver and is able to offer affirming care, even if they themselves are not based in the same location as their clients. At the same time, we're working with health authorities across the province to offer pop-up testing and counseling services in person. We have prick events happening in the interior, in I think 5 communities across the interior, and we're working with health authorities in Prince George, or rather in North and in Vancouver Island, to offer similar kinds of services, recognizing again that the way to really get the services that queer people need is by making them accessible to them, is by tailoring services to their needs and ensuring that they're safe and promoting them as safe and letting people know that these are safe and letting them know how we've made them safe.
Simon, thank you so much for being with us today.
Great, thanks for having me.